welcome to Across the Fence. I'm Jolie Whitney. Equity comes in all shapes and sizes. Race or gender might be the first words you associate with working towards equity, but what does it mean when it comes to your health? It's imperative that someone living in a rural area receives the same medical treatment as someone living in a city. And what does equity look like for healthcare workers, nurses, for instance? How about someone who identifies as LGBTQIA+? What about for women? All big questions that require thought, sincerity, and deference. The third annual UVMMC Health Equity Summit takes place on October 7th and 8th in the Doubletree Inn in South Burlington. This two-day event is free and open to the public. The goal of the summit is to advance equity in healthcare for hospital employees, community leaders, advocates, learners, and patients. Joining me to talk about the summit is Dr. Marissa Coleman. She's a clinical psychologist at UVMMC, where she also serves as the hospital's Vice President of Diversity, Equity, Inclusion, and Patient Experience. Welcome, Dr. Coleman.
Thank you. Good morning.
We've already gone over some of the logistics of when to show up and where to go, but can you tell me a little bit about why this is such an important conference?
Absolutely. So it started 3 years ago out of a need for us to unite the efforts around health equity within our region. So the conference spans all of Vermont, the New Hampshire, Massachusetts, and Northern New York. There are many people that are working towards advancing health equity, and we needed a place to bring everybody together.
All right, and I think everyone knows the dictionary definition of equity, but when it comes to healthcare, what does it look like and kind of how far does it go?
Yeah, well, really, health equity is the attainment of the highest level of health for every person, and it really values and honors the fact that we need to look at the societal barriers that have prevented health equity from advancing for all communities. It's one of the things where it really indicates that we value all people and their health.
And you've spent the last couple of years kind of focusing on improving health equity at UVMMC. Can you talk about kind of your work there, or do you think you're all caught up?
Oh, not at all. I think we're just getting started. And one of the things that participants at the Health Equity Summit will realize is that we really value community presence in this work, community voice, and the knowledge that is inherently a part of the community. And so it's really people coming together, wanting to collaborate, learn about how working together and building partnerships can help to decrease health disparities. And at UVMMC, there are a number of initiatives that our department is working on that span from patient and family care, employee wellness, as well as our community engagement.
So equity isn't just on the patient side or just on the healthcare provider side, it's both?
It's both, and I would say it's all facets of being human and being alive. Our health is not just one facet, it embodies many things that make us be able to thrive in society. And so what that means is that we don't care for somebody just physically, but we also think about their mental health, their well-being, and not just for patients, but also for our employees. Or many of them are our patients, actually.
Absolutely, and UVM Medical Center has been focusing a lot on kind of the patient side of that. What are some examples that a patient should be aware of if they feel like they haven't been treated equitably?
Well, first and foremost, if a patient comes into our doors and they feel as though they haven't been treated equitably, then we really encourage them to reach out to our patient and family advisors, our patient and family advocacy team. And that is a place to receive support, but also to help inform our system about some things that we need to change. There are some concrete efforts that have occurred. I'm really proud of our hair equity work. We now, on every inpatient floor, provide inclusive hair care products for all hair types. It's one thing that many may feel like, oh, that seems insignificant for healthcare, but really when somebody is ill and they feel powerless within a system and it's really big and hard to navigate, honoring their dignity is really important. And so we've received a lot of feedback about that being something that's been really helpful. The last thing that I'll share about just our patient care is that we recognize that there is an increasing need for gender-affirming care within our state, as well as within our health system. And so there's been a ton of efforts related to how we are asking about patient identity as it relates to gender identity and sexual orientation, but also how are we training our staff to share their pronouns and ask for their patients' pronouns is one small example.
And this is going on beyond just the walls of UVMMC. Can you talk about how you've worked to engage the community in this conversation?
Yeah, that's one of my favorite parts is that, again, engaging the community, there's so much wisdom within the community. There are people and community organizations that have been doing this work long before UVM Medical Center. So with that said, we engage in a lot of community listening sessions. We recently did one this fall for our patients that have disabilities, and wanting to understand more about how we can increase our accessibility for not only our patients but our employees. And so there's some great work ongoing from my team related to that. We also, the Health Equity Summit is a wonderful example. And then we, as a health system, have the Community Health Needs Improvement. And they do an assessment where every 3 years they identify three priority areas within the community that we are going to really target and work collaboratively to help improve.
And one of the conversations we already touched on a little bit, or you did, I should say, is the LGBTQIA community. And what have you've been working a lot across the state to kind of talk about how gender identity plays a role, and a lot of the time it can become kind of partisan or political, but your work has kind of risen above that a little bit. Can you tell me what concerns you've heard from the communities you've been working with?
Absolutely. You know, and I think it's important to note that the fact that caring for any community, the fact that that could become political is really the crux of the problem. When we are bound by our ethical code, when providers take the Hippocratic Oath, we are committed to caring for every human being to the best of our ability. And that includes our communities that have been historically marginalized, like our LGBTQIA community. And so we have a wonderful partnership with the Pride Center. We've done listening sessions with them, collaborated with them on a number of events. Recently, we co-hosted a film showing to increase the awareness of intersex individuals within our community and the needs that they have within our healthcare system. And then again, I'm just really proud of the work that all of our teams have been doing throughout the health system, particularly around how are we collecting sexual orientation and gender identity data, how are we asking patients about their identities in a way that's affirming, and really how are we listening to the community. The community has been very clear about the ways in which they feel that we need to do better. They are correct. We are committed to doing that, and it's taking the partnership to improve.
And this year, UVMMC kind of expanded to include some oversight of the hospital's patient and family experience department. And so how are you going to focus your work there on diversity, equity, and inclusion, and kind of have that inform your work moving forward?
Yeah, so I'm thrilled about that connection and the combination of the DEI team as well as the patient experience team. The teams already had been collaborating for the last few years. There's the patient experience team is wonderful, and they have a big breadth of experience throughout the system. And so some specific examples of how we are incorporating it is we are really looking at our data that comes out of the patient experience team, not only our patient experience data, but also the data that the patient family advocacy team is tracking. So quantitative and qualitative data on what our patients are saying. And we're making sure that we can disaggregate that data so that we can say, okay, this is, for example, if we have patients that practice from the Muslim faith, this is how they are saying they're being treated. And these are the things that they, that would be more affirming to them in their healthcare. And so there's just a really natural collaboration that's been occurring across multiple councils, our patient family advisors. It's been a really natural fit.
And we've talked a lot about the patient side of things, but let's talk a little bit about the staffing side of things. Vermont's healthcare workforce shortage is kind of always in the news cycle. So what has UVMMC been doing around health equity, DEI, and the workforce shortage?
Yeah, so quite a bit. Again, the workforce development team is a wonderful team that we collaborate with quite a bit. They have increased our pipeline programs. They are increasing representation for underrepresented folks that within medicine. The next fiscal year into 25, we're going to be focusing quite a bit on working with community colleges, high schools within the area to really increase representation in healthcare across all of the careers in our immigrant and refugee communities, LGBTQIA plus communities, to name a few.
And you've talked kind of about the small things to include to kind of support either the workforce or the patients. What are some of those small things that you can think of that have helped employees feel kind of seen at UVM?
Yeah, so probably the best example I can provide is about 4.5 years ago, we started, Dr. Leffler, our president of the UVM Medical Center, him and I started a equity and justice listening session series. So once a month, we rotate topics based on either national recognitions or cultural recognition months. And I have a co-facilitator that joins me for that. And we essentially run an organization-wide process group. So as a psychologist, that's something that I often would do on the clinical side, and it's been really wonderful to do that organizationally. We talk and reflect together about different topics. We discuss how we can support each other within the organization as colleagues. And Dr. Leffler said in 2020, we'll keep doing them as long as people show up. And every month we have approximately 75 people that show up, and the conversation has really increased in depth, and we've gotten a lot of feedback that has helped people feel a sense of belonging within the organization.
Do you think that working in equity with patients and then also with the employees or people who work in healthcare, do you think there's an intersect where one helps support equity in the other?
Absolutely. So just like any caregiver, whether you're in healthcare or you are caring for your family, the best care you can provide and the highest quality of care you can provide is also when you're taking care of yourself. So if all of our employees continue to be drained and depleted, then what do they have left to offer their patients? And so there's been a lot of wonderful collaborations with our HR teams on employee wellness, really valuing the work-life balance and trying to recognize employees in ways that are meaningful to them.
And this event coming up is open to the public, so what do you hope that people coming, maybe a layperson like myself who doesn't know a lot about healthcare equity, what do you hope we get out of this?
I hope that you get out of, I would hope that anybody that attends walks away with a sense of community, this feeling of pride about being a part of something that's larger than themselves, that's going to make a difference on not just the people that attended, but also the healthcare landscape of our state, of our region. Many partners within Northern New York have been collaboratively building this summit for the last 3 years. And so recognizing that doing something alone, we have a certain amount of impact. But when we come together and there's 1,000 people that engage with this summit every year, the impact and the ripple effects of that go beyond that event.
All right, thank you so much for joining us today.
Thank you for having me.
And the third annual Health Equity Summit takes place October 7th and 8th. It's free and open to all. For more information, you can visit the website on your screen. And that takes care of our program for today. My thanks to our crew behind the scenes here at WCAX who make our visits across the fence possible. I'm Jolie Whitney. Have a good one.